everybody, welcome. This is Teresa Mealy. You can find me on Facebook at Teresa Mealy Total Health and Wellness. I am going to talk just a very brief time about thyroid. So if you're short on time and you just need a little clip of one of the hormones, this is a good one to start at, thyroid. It is a under-recognized problem here. It is a undertreated problem here. A lot of women and men go looking for answers to a lot of their symptoms: depression, anxiety, fertility, libido, hair thinning, hair falling out, blood pressure, cholesterol issues, brain fog, difficulty concentrating, gaining weight, cold feeling, all of these things, constipation, all of these things can be thyroid related. But when you go to your regular doctor, they'll say, you're just depressed, you're getting older, maybe you just need an antidepressant instead. So I just want to talk to you about thyroid, the importance of it, what to ask for from your provider or your doctor, and how to get testing for it so that you can help your provider figure out what's wrong with you and help you be in charge of your health to empower yourself. So the thyroid is a small gland in the front of our neck, right around our Adam's apple here. It's produces our thyroid hormones. It produces 4 thyroid hormones: T1, T2, T3, and T4. But the ones we really care about are T3 and T4. The thyroid gland produces 80% T4 and 20% T3. The one we really care about is T3, and that's the one that the thyroid gland produces the least of. But that's the one, T3 is the hormone that is the most metabolically active in our system. So it's the one that resolves symptoms. So when you're having all those symptoms I just listed, brain fog, constipation, hair thinning, cold hands, cold feet, it's T3 that's the problem or the issue that you need to resolve those symptoms. So the other thing it can be responsible for is iron deficiency anemia and carpal tunnel. And it has a significant adverse effect on mood, causes a poor sense of well-being. So thyroid and testosterone, which we're not going to talk about testosterone today, but I also love testosterone, but thyroid and testosterone are the feel-good hormones for men and women. So if you're low in thyroid and you're low in testosterone, you're struggling. So you need those both. Those, like I said, they're the feel-good hormones. A dysfunctional thyroid gland will stall weight loss and slow metabolic rate no matter how meticulous you are with your diet and no matter how extraneous or consistent your exercise is. So no matter how those things go in your life, if your thyroid is not optimal, you will run into trouble. Remember the difference between optimal and normal values. We don't want to just be normal. We want to be optimal. We don't want to be normal for our age. We want to be optimal. So like a 70-year-old man is optimal usually with testosterone. Let's use that. That's a good example to notice the differences between normal and optimal. So a 70-year-old man has, let's be generous, a 400 level of testosterone. So that's pretty normal for a 70-year-old man. But when you look at a 70-year-old man, they probably aren't having great sex. They probably aren't having hard erections. They walk a little hunched. They probably have a little bit of coronary disease going on. They probably don't sleep as well. They probably aren't energetic playing golf and tennis every other day or every day. So a 70-year-old man has a normal testosterone level of 400, but is that optimal? What that 70-year-old man probably wants to feel like is when he was in his 40s again. So that's the difference between normal levels and optimal levels. So don't be confused when you go to your provider. And when I say provider in any of these videos, I am meaning doctor, MD, DO, or a nurse practitioner, PA, any of those kinds of people. If we tell you your hormone levels or your thyroid level is normal, don't go with just that. You want to see the actual number for the lab level and compare it with optimal, which is usually about 75%, at least 50% up on the range. So the conventional way that we treat or test for thyroid is we test TSH. That's what you're taught in school. You're taught to test TSH and treat thyroid symptoms based on your TSH level, which is thyroid stimulating hormone. This is a bad way to do business because the TSH, or the thyroid stimulating hormone, does not have anything to do with the actual thyroid hormone. It's not an actual thyroid hormone. It's a messenger that is sent from your brain, from your pituitary gland, sent to the thyroid gland here in your neck, and it tells the thyroid gland to make T3 and T4. Actually, to make all those thyroid hormones, T1, 2, 3, and 4. We're really concerned with 3 and 4. So the TSH is not an actual thyroid hormone, it's a messenger. It tells your thyroid to produce more hormone. So why do we test TSH if that actually doesn't give us an indication of how much T4 and T3 is circulating in the brain? Because that's what we were taught. You're taught in school, take a TSH level and you manage that. You prescribe medicine to get the TSH where we want it to be, and then you call it normal. So like I said, the TSH stimulates the thyroid gland to produce more hormones. Now there's problems we can have with our hormone gland. Number one, we can have the kind where the production of hormone decreases. So you're having a whole bunch of TSH sent from the pituitary gland, telling your gland to make more hormones, but it just doesn't do it. TSH rises because there's more and more coming out trying to get your thyroid gland to work, but there's no T3 or T4 coming out. There's another kind where you can have poor conversion from T4 to T3. So when remember I told you the thyroid gland makes more T4 than it does T3, we anticipate that your T4 is going to convert to T3 and we'll have resolution of symptoms. However, age, stress, malnutrition, diseases or illnesses or conditions like PCOS, polycystic ovarian syndrome, those people, those gals that have that, they don't always have the correct enzyme needed to convert T4 to T3 because it takes an enzymatic reaction to do that. You can also have thyroid cell receptor sensitivity. So it means that your thyroid is producing enough thyroid hormones that are going to your cells, but they're resistant, just like you have insulin resistance in diabetics. So when you go to the doctor, when you go to your provider, nurse practitioner, PA, doesn't matter, you need to ask for these tests. A TSH, a free T3, a free T4, reverse T3, and the thyroid peroxidase antibodies, or TPO. You can also ask for thyroglobulin antibodies, and then I also run a selenium red blood cell count on everybody, and then sometimes we do iodine testing, and then sometimes some adrenal cortisol testing, because that can have some implications with thyroid as well. Now, for instance, your TSH range is 0.4 to 4.50 on most labs. So if your level comes in at 4.4 and the level goes up to 4.5, your provider is going to say you're normal. It's not out of range. Even if it's out of range just by a couple tenths of a point, a lot of times providers will not treat that. Why? It's a good question. Free T3 is what we care about though. The range on some labs, if you're like around my age, which is 45, the range is 2.3 to 4.2. If you're 2.5, your provider's going to tell you you're totally normal, you don't have low T3. That's bogus, and that's a lazy answer in my opinion. You want to be upwards of 4.0 to get relief of symptoms, to get the best outcome that you can get with T3. So my medical term for 3.0 or below is in the toilet. I don't want 3.0 or less. I want upwards of 4.0 to 4.2. Also, reverse T3 matters. If you have high reverse T3, it means that you're having some sort of adrenal dysfunction, adrenal fatigue, adrenal problems. And so this is an important piece that a lot of people miss. A lot of providers do not run this. And it's very important to have a good, accurate measurement of reverse T3. Reverse T3 sounds like it's T3 and it sounds like it would resolve symptoms, but it won't. It blocks the receptors for the real T3, so it's basically unusable. You can't use this reverse T3. So you want to know if you're converting T4 to T3, but if you're converting T4 to reverse T3, it's like having money in the bank that you can't use. We don't want that either. So it's really important that you measure reverse T3 so you can make sure that the T3 you're converting to can actually be used by your body. A lot of people do T3 and T4 uptake. I think those are outdated. I think you need the free flowing or the free levels of the hormones to see what your body's actually capable of using. So again, T4 converts to the metabolically active T3, and that's where we get symptomatic relief. The conversion depends upon enzymes, so if you don't have the correct enzyme or your enzyme is damaged, you don't convert either, and so you're not getting that metabolically active T3 going around in your system. Like I said, the conversion can be blocked by things like PCOS, environmental factors like fluoride, pesticides, insecticides, GMO foods, industrial products like flame retardant things that get sprayed on mattresses and couches and car seats and all these other things, triclosan in hand sanitizer. So all of these things can be detrimental to our thyroid. Also, the number one disruptor of thyroid health is grains. So in my practice, I advocate a grain-free life and a grain-free diet. And grains is not just wheat. Although gluten is a big culprit, it also includes the other grains like corn, oat, rye, barley. So we want to stay away from those things because they're highly inflammatory and they damage our thyroid. Can set you up for the Hashimoto's, which is the autoimmune thyroid condition. So we don't want those. And then a lot of times the other issue is when you do go to the doctor, and if you're lucky enough to have your TSH out of whack, so you can actually be told, yes, you have a problem, you're not crazy, it's not in your head, it's not just PMS or age or depression. A lot of times providers treat you with a T4 medicine only, which is Synthroid and levothyroxine. Those things are not adequate because, again, it feeds your body T4, and you're hoping and praying that your body can adequately convert T4 to T3. Remember, we want T3. That is the metabolically active thyroid hormone. So if we give you a T4 only medicine and your body can't convert it because of enzymes or environmental factors or stress or malnutrition or whatever, then you're in the same boat. Your TSH will come down, but your T3 won't come up and your symptoms won't resolve. But again, your doctor, provider, runs the lab and sees your TSH went from 6 to 3. Fantastic, we're done. It's perfect. This is the dose you need to be on. Again, that's not true. Most people need a combination thyroid medicine, and there's natural ones called Armour, Nature Thyroid, West Thyroid, and then you can also get them compounded at the compounding pharmacy. So those medicines have T4 and T3 already in it. They give it to your body, so your body's getting T3, getting T4, not waiting around for a conversion. So you get much better symptom relief. Now then you might say, well, why don't we just take T3 only? Because it's so great. I mean, you sound like it's so great. So the problem with a T3 medicine only is we do need T4 because our brain needs T4, and T4 crosses the blood-brain barrier very easily, and it has the enzymes needed in the brain to take care of the conversion. So while your body needs T3, your brain needs T4, and T3 cannot cross the blood-brain barrier. So that's why we need that. Now, so just to finish up, one thing I want to say too is there are a plethora of studies showing why we need thyroid. So I'm just going to run through a couple. The Journal of Gerontology states, our data suggests that older subjects may require circulation thyroid hormones in middle to high levels in order to maintain optimal brain functioning. Well, hey, isn't that great, optimal brain functioning? Who doesn't want that? Variations in these levels can have significant cognitive consequences, even in apparently euthyroid subjects. Euthyroid means normal thyroid. That means your TSH is within the range. That's euthyroid. So even in euthyroid subjects, you can have significant improvement in cognition by giving thyroid. Another big another big journal is the American Journal of Cardiology, and there are many of these studies in the cardiology journals because cardiology, if they know that T3 is specific for heart function. So in one of the articles in American Journal of Cardiology, most patients with advanced congestive heart failure have altered thyroid hormone metabolism. So there is not one person, I'm sure, out there that doesn't know somebody that has congestive heart failure. A low T3 level is associated with impaired hemodynamics, that just means blood circulation, and is an independent predictor of poor survival. Are you kidding me? So this alone, thyroid alone, is an independent predictor of poor survival. That's a big deal. And then in another article in the Cardiology Journal, it is well documented that patients with advanced heart failure after coronary artery bypass surgery and after a heart attack have altered thyroid hormone metabolism with low levels of T3. The decrease in serum T3 levels occurs primarily as a result of decreasing conversion from T4 to T3, causing a low T3 or non-thyroidal illness syndrome. So while this goes on and on, there's the British Medical Journal, there's the Annuals of Internal Medicine. It is a plethora of science. One of the best known thyroidologists, Dr. Bruce Weintraub, he worked at the NIH and then most recently at Mass General Hospital in Boston. He feels that it is very important to give a therapeutic challenge of thyroid to patients with unexplained fatigue that might be at risk for functional hypothyroidism. When the body produces reasonable amounts of the thyroid hormone, if that receptor is altered by metabolic acidosis or by toxins that bind to the receptor and distort it, or by antibodies to the receptor, then the hormones will be less effective and people can have functional hypothyroidism because of receptor defects, even when they have what seems to be reasonable amounts of circulating thyroid hormone. So what does that mean? It's like a mouthful. It basically means he's a leading thyroidologist and he thinks anybody that comes in with depression, unexplained fatigue, those people should be given a thyroid challenge, which just means the provider knows that you don't have abnormal levels and you don't actually have hypothyroidism, but we're going to give you a trial of thyroid medicine to see if it resolves symptoms. How about this? Isn't this interesting? You go to your doctor. This happens probably every second of every day that offices are open for medical practice. You go into your doctor and you tell them you're having fatigue, a little bit of depression, some brain fog, you can't concentrate, you just don't feel like life is fun anymore. What do they give you? Right away, what do they give you? Prozac, Paxil, Wellbutrin, Zoloft, Lexapro, Celexa, any of the antidepressants. Do they ever check a level for you? Ever? No, because there's no level to show you have a serotonin deficiency. But they sure can give it out like it's no problem. But everyone is so reluctant to give a trial of thyroid hormone, even based on the plethora of clinical studies in well-respected journals. It's amazing to me. So if you cannot find a provider who will test your thyroid correctly or try a thyroid challenge on you based on your symptoms, fire your provider and find another one. When you pay for me to come see me, I become your employee. You are my customer, and I'm going to do everything I can to help you. When patients come in with these kinds of symptoms, why would we not try everything, including a thyroid challenge? Why would I give you Lexapro, Celexa, Wellbutrin, Zoloft when I have no proof that you have a serotonin deficiency? It's not like that. We need to be trying better things. You can also call around to your local pharmacies, like even Walmart, or a compounding pharmacy, and ask who calls in compounded thyroid. Ask the local pharmacies who prescribes Armour, NatureThyroid, Westthyroid, because those are the providers that you need to go to. That means they have at least a basic understanding of thyroid and are willing to prescribe those medicines. It is unconscionable to me that patients have been ignored, denigrated, overlooked, and undertreated as long as they have by conventional medical practices. Patients are told their problems are absolutely not your thyroid. And these symptoms are depression, stress, PMS, or simply in your head. I think that is a lazy answer, and I think it's a bogus answer. We as providers should start listening to our patients because you guys are the customers. So with that, I'm going to end it. I wanted to just give you a quick update about thyroid. Thyroid is huge with pathophysiology. It has a lot of intricate workings, but you need to find a provider that's comfortable doing this. You can also look on worldlinkmedical.com. That's where I was trained in bioidentical hormone replacement therapy. You could try and look up a provider in your area, or like I said, you can start calling around to pharmacies, even conventional pharmacies like Walgreens, CVS. They have a list of these medicines and who prescribes them. And just get on the road to health. Demand that your providers do these lab levels and demand to not be told it's normal just because it's in range. Just because it's 1/10 of a point in range on the low side, that's not what we want. We want on the high side, we want optimal. So thank you for listening. See you guys. Bye.